is Karen A. Salvatera, a BSN-3 student, and today I will be applying topical medication.
Gather equipment. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness of the medication for the patient. Perform hand hygiene. Prepare the medications for one patient at a time. Read the MAR and select the proper medication from patient's medication drawer or unit stock. Compare the label with the MAR, medication administration record. Check expiration dates and perform calculations if necessary. When all medications for one have been prepared, recheck the label with the MAR before taking them to the patient and return the medication stock to patient's drawer. Transport the medications to the patient's bedside carefully and keep the medication in sight at all times. Ensure that the patient receive the medications at the correct time. Identify the patient. Usually, the patient should be identified using two methods. Compare information with the MAR. Check the name on the patient's identification band. If the patient cannot identify him or herself, verify the patient's identification to the significant others.
May mga allergies po ba kayo, ma'am?
Complete necessary assessment before administering medication. Check allergy bracelet or ask patient about allergies. Explain the purpose and action of each medication to the patient. Perform hand hygiene and put on gloves. Use non-sterile gloves unless the skin is broken. Then apply sterile gloves. Wash, rinse, and dry the affected area with water and clean gauze. If skin is very dry and flaking, apply topical medication while skin is still damp. Make sure to put rubber sheet and kidney basin to catch water while washing the affected area. Change gloves and perform hand hygiene in between. Use sterile gloves for open skin lesions. Place a required amount of medication using a cotton tip applicator. Note the cotton tip applicator is sterile and is for single use. Let the patient know that the initial application may feel cold. Apply medication using one stroke and observe the inner to outer application. Observe for signs of irritation or redness.
Ma'am, may nararamdaman pa ba kayong makate? Or okay lang?
Perform hand hygiene. And finally, document the procedure in patient's chart.